822, Big 550, KTRS, Cat Neville from Feast Magazine. We're going to get our feast fix here in a bit, but Dr. Bradley Freeman is with us. He's filling in for Jeffrey Lowell. He is a professor of surgery at Washington University. Good morning, doctor.
Good morning, McGraw.
Let's talk about this story. It's kind of a big deal this week and sort of convoluted. What they want to redefine cancer? Explain this.
Well, I think this really represents an evolution in our understanding of what cancer is. And as you can imagine, anybody that is labeled with a diagnosis of cancer finds that psychologically devastating. And I think what this multidisciplinary panel of cancer specialists propose is that cancer clearly is a range of conditions. You know, some of them are very serious and life-threatening, and even in this day and age are very resistant to treatment, and others are very indolent, and in fact probably result in people dying with them, not of them. And I think this represents that we're very good now at detecting cancers in a more treatable stage, and detecting a lot of conditions that might or might not be serious. And so with that background, what this panel proposes is really to, if you will, stratify or come up with tiers of designations, some of which would retain the diagnosis of cancer, which would connote a condition which is serious, if you will, potentially rapidly progressive, requiring some form of intervention, whether that would be, say, surgery or chemotherapy or radiation therapy or a combination of all those treatments. And secondarily, there are more indolent conditions that they would propose to label no longer cancer, but more indolent lesions of epithelial origin, and that's kind of a technical term. But what it connotes is conditions which might require a clinician or doctor to follow, and they might have some potential down the road to become more serious. But in essence, they don't have the same prognosis and same grave implication for the patient. So I don't think that this is just wordsmithing. I think this is a real, again, advancement in our understanding of the biology of the disease, and an effort really to stratify or separate patients into those that really have a serious condition and those that have a more indolent condition, that probably don't really merit the label of cancer.
You said something really interesting in that, and you said that people die with it, but not because of it. Explain that.
Sure. Well, I think one thing that I think has become apparent as again, clinicians have become very good at screening for various types of cancer, and one which would come to mind might be, say, prostate cancer. And I think we've talked before on this show about recommendations with respect to men undergoing routine screening of the PSA test, which is a blood test which in the last year or so has been discouraged as a routine screening method. But based on a lot of that work, and that's really involves thousands of patients and decades of work by very dedicated researchers, they found that some men would probably have prostate cancer. You could demonstrate prostate cancer. The nature of the prostate cancer was very indolent, meaning very benign, very slow growing, had very low potential to, say, spread beyond the prostate, and that they found that in men that had this very benign condition, that they did just as well with just watching them or following them clinically as they did with doing more aggressive things such as surgery to remove the prostate, radiation therapy, and those things, all of which have a cost in terms of morbidity, whether it might be impotence or complications from the surgery or those types of things. And it's certainly prostate cancer is a very complicated issue, but in men that would have, say, this very benign and slow-growing condition, they would appear to do better without any medical or surgical intervention, and they kind of would fall in the category as somebody that would die with the disease, not of it, meaning that it might exist for decades with it and never really cause these men a problem.
Yeah, so, that's so fascinating that we've come to this point in time when some cancers are worse than others, and the treatment is worse than the actual disease in this situation.
Right. Well, and I think again, we're just, despite the fact that people have dedicated their careers and decades and billions of dollars to researching this, I think we are really at the cusp of a new age with new technology and working with the Human Genome Project to really understand the individual behavior of a cancer and how a cancer not only behaves as a category, but how it might behave in the individual patient, how one can really tailor the therapy to that individual. And I think it holds enormous promise to developing and implementing therapies that really have the maximal opportunity for benefit and minimizing harm and complication. And I would say we're not there yet, but I think that's the promise, and I think we're moving into that era. And there's obviously continues to be a huge investment to understand how to individualize cancer therapy.
Yeah, it's also it's a really interesting debate, I guess, or conversation, because I have friends who've had bladder cancer, and they go in every six months and get some polyps removed, and it's like, oh, I got cancer surgery on Tuesday, I can play golf on Friday. I mean, that's pretty remarkable when you think we can handle cancer like that.
It's a great advance, absolutely, and it keeps people in a great lifestyle and minimizes. It treats the cancer and minimizes complications from therapy. So I mean, you can't ask for a better outcome than that.
Yeah, Dr. Bradley Freeman, we're going to leave it there. Interesting stuff. Next week we got to get you to Skype next time.
All right, I will work on it, McGraw. As I told your producer, I have a face made for radio, so I'm not sure you want to Skype me.
I mean, all this advances in medical technology, and you don't know how to set up a Skype.
That unfortunately is the fact.
Dr. Bradley Freeman, thank you for joining us. Have a good day.
Have a great day.
You got it. Dr. Bradley Freeman with us, professor of surgery at Washington University. He's a very good fill-in for Dr. Jeffrey Lowe, and a good guy as well. Traffic, weather, news, then Cat Neville with Feast Magazine. Don't go anywhere. Our favorite segment of the week is back on the Big 550, KTRS, and STL Today.